Hi, parents. I'm Dr. E again, a biomedical therapy expert. So today I would like to discuss a topic that is actually very close to my heart, or that is acute auditory hypersensitivity in autism, or in another word, hyperacusis. Okay, so do you notice that, parents, right? Do you notice that some of this autistic child, or perhaps it could happen in your child, that sometimes they do keep on closing their ears, closing their ears, scream, steam, flapping their hands, agitated, anxiety, and at times become very aggressive. All right. So if that's the case, then most likely your child could have this condition. Okay, so what is acute auditory hypersensitivity? Okay, so it is a condition where everyday sounds are perceived as painful. The keyword is painful, all right? Psychological pain. It's not physical pain, but it's psychological pain. Imagine that every day you're hearing sounds that you do not like to hear. Okay, so sounds could be overwhelming or sometimes threatening. Okay, so sounds that are normal for others. For example, vacuum cleaner, school bell, blender, hair dryer, traffic noise, and etc. Or even the sound of aircon blowing could trigger distress, fear, or at times shutdown or meltdown in an autistic individual. I believe a lot of parents have witnessed their child having the same conditions or other autistic child or special needs child with presented with a similar problems. Okay, so what are the common signs and symptoms? Okay, as usual, first, they used to cover their ears, running around in the room, okay, screaming, fleeing from the sound, running around, banging their head, hitting their body, okay. They are so anxious, so panicked when anticipating certain noise, okay. At times, they can become very aggressive, all right, self-threatening, self-injury, and sometimes their attentions and learning could also reduce, okay. And worst case, they could have sleep disturbance due to noise sensitivity. This is very common, parents, okay. Sleep disturbance. Imagine that at night, constantly hearing the blowing of the fans or the aircons. Okay, the aircons, the noise of the aircon blowing, that actually cause extreme distress, fear, and at times painful condition. Okay, which for a normal kid or a normal adult like us is completely normal, is okay, but it's not okay for your autistic kids. Okay, so the next question is, why does it happen? What is the pathophysiological behind the so-called painful conditions? All right. So first, most of the autism symptoms, autism kids, they have this sensory processing difference. So meaning that, okay, the brain amplifies sound input, okay, instead of filtering it, okay, and they have difficulty in separating background noises from important sound, okay. For example, when the kids actually stay in the room doing a consultation with the therapist, with the doctor, child actually constantly actually hearing the voice of the doctor, the voice of the parents during the discussions, and in the same time there's an echo in the room, and the worst thing is the aircon aircon fan is keep on blowing. That actually cause the child become very overwhelmed, very feel threatened, and in long run, it cause painful, psychological painful condition. Imagine that, he's sitting in the room, listening to the doctors, listening to the parents, listening to the fan of the aircon, constantly the body keep on regulate, keep on needed to regulate the anxiety. So at the end of the day, the child will actually, what happened? So will be in distress, fear again, and it causes meltdown. Okay, this is a very common scenario that I think a lot of parents witness during the consultations. Okay, this is one of the example. Second, the cause or pathophysiological is neuroinflammation and oxidation stress. Okay, so there's inflammation in the auditory pathway, which actually increase the sensory reactivity. All right. So, and the other one is autonomic nervous system dysregulation, meaning that the child is in constant fight and flight situation. So, meaning that persistent hearing of sound constantly causing a lot of anxiety symptoms, palpitations, hand tremors, coldness of hands, breathing difficulty, which actually the child is unable to express the anxiety feeling. Okay, the next cause is gut-brain axis involvement. This is also a lot of studies, a lot of discussions, debates on this gut-brain axis. Okay, so dysbiosis, so meaning that there's a lot of overgrowth of bad bacteria, food sensitivity, example towards gluten, casein, sugars, or leaky gut symptom could worsen the sensory symptom. And the last one is medical contribution or underlying medical conditions, which actually often be overlooked. Okay, so ear infection, parents, ear infection, impacted wax can cause inflammations. So inflammation can cause discomfort. All right, allergic rhinitis, inflammation of the nasal pathway or inflammations of the nose, sinus congestion. Okay, sinus congestions, migraine, anxiety, and sleep deprivations. These are the few of the medical example of the medical condition that could worsen this acute auditory hypersensitivity. So from today onwards, parents, the moment whenever your child is closing his ears, constantly screaming, steaming, flapping, hitting his chest, jumping around, hitting hitting his head, or banging his head against the wall, running around in the room, then this is the time that you have to, okay, check for any underlying ear infections. Okay, check for impacted wax. Check for any sinus. Check for any allergy, nose allergy. Check for any symptom of like gut inflammations, any food sensitivity. These are the things that you have to actually look into it. Okay, all right. So the next thing is parents will ask, okay, doctor, how should I treat? What are the management of this acute auditory hypersensitivity? Okay, so there's actually various multi-dimensional approach. Okay, for example, the common one, environmental and sensory strategy. That is the first line. So I'm not going to actually go deep into it. For example, using noise reducing headphones. Second one is occupational therapy, where actually they have a lot of sensory integration therapy to calm down the auditory sensitivity. Then the other one will be auditory based therapy, for selective child. Usually, I mean, they expose the child to certain noise, certain sounds that they are sensitive to. Okay, so these are the very basic one. But what I want to emphasize is the next two one. It's very important, parents. Okay, the next two one is diet and nutritional support. Okay, first, let me talk about diet interventions. Okay, first, okay, you have to remove those food trigger like gluten, casein, addictive, preservative, in a sensitive child. So all these things, as you know, it actually trigger gut inflammations, which again, you can cause worsen of these conditions. Second thing that you have to avoid all these added preservative, or sorry, you have to avoid all this processed sugar. Okay, so avoid too much of sugar, avoid the child drinking too much of sugary drinks or food. Okay, this also will trigger inflammations. All right, and also improve the gut health with targeted probiotic. So the probiotic that we actually advise you to take is, I think, the 5-layer probiotic that I always talk to a lot of parents. You need a 5-layer protective probiotic, high dose 30 to 50 billions, and probiotic that is actually free from sugar, free from casein, free from gluten, free from soy, and free from any additive. All right. So that is first diet interventions. Very important. Second thing is the next important treatment and management plan is nutritional and biomedical support. So this is commonly very helpful. So this nutritional support is actually, we use a lot of supplements. It helps to support the neuroinflammations, control the gut inflammations, reduce the stress response, calm the nerve, reduce the what we call the nerve hypersensitivity, and it support production of neurochemical that is essentially help to inhibit the hyperactivity or inhibit sounds, okay, or filtering sounds from keep on, stimulating the auditory organs of the autistic child. All right. Okay. So what are the supplements that usually we suggest? First is magnesium. Very important. Magnesium, parents. Okay, take notes. Magnesium. It helps to calm down the auditory nerve excitability or hypersensitivity. Vitamin B6 support GABA synthesis. So as we know, GABA is one of the neuroinhibitory type of neurotransmitter. Okay, so zinc. Okay, so zinc is very important for immune balance and sensory modulations. All right, so L-theanine, it helps to reduce sounds and that actually trigger anxiety. So as we know, L-theanine is green tea, so it helps to modulate the serotonin pathway. All right. So then we have antioxidant. So antioxidant can come with plant-based, berries, vitamin C, or vitamin A, D, E. Okay. Then we have the other one is vitamin D for immune and neuroregulations. Again, the last one will be omega-3 fatty acid. It helps to reduce both gut and brain inflammation. So that's why for a lot of parents, please start with this basic supplement. Please, again and again, I want to emphasize, do not go for straight or immediately go for this high-end or very high funnel type of type of supplements. Okay, just go slow at one time. Introduce at the very low dose. Monitor the behavior. Remember, the key is magnesium, B6, zinc, L-theanine, antioxidant, vitamin D, and probiotics. Yes, another one is probiotics. Don't forget your probiotics and your omega-3 fatty acid. So these are the basic supplements, which 80% it helps to reduce and to manage these conditions. All right. And last one, okay, which often being overlooked. How often do you bring your child for dental checkup, ear checkup, nose checkup? No, right? None, right? Or bringing your child to the gastrology or to the gastro doctors to check for their gut condition. I don't think so. Or most of the parents don't do it. Okay. So this is, I think, something that you have to take notes on. Okay. So if persistently, you see, closing of ears, they have two types. One is acute, immediate. Okay. The other one is constant, chronic. Okay. Those are in the chronic form, presented in the chronic form, constantly, every day, every minute, every hour, every month, non-stop, closing the ears, hitting himself, flapping, playing the fingers, overwhelmed with different type of sounds, screaming. Yes, these are the group of children that you have to bring them to seek the immediate medical specialist to rule out any E ENT, ENT pathology, just to rule out any inflammations of the nose, inflammation of the throat, inflammation of the ears, inflammation of the oral, the mouth, the tooth, So please do that from today. Okay. So go and get a doctors or specialists, which are actually who are special needs friendly. I believe there's a lot in your community. Okay. So these are the things that you need to do. All right. And don't forget, lastly, for severe cases, uncontrolled, not able being controlled, okay, start to self-hurt, aggressive, and it will start to affect his daily activity, daily life. Yes, short term of medication is a must. Short term, okay, just to reduce the anxiety, start with very low dose, calm down the nerve, balance the neurotransmitter, and reduce all the symptoms, all the anxiety symptoms, so that it will help your child to get rid of the psychological pain because of the constant sound stimulations. Okay, so last one, prognosis. What are the outcome? Okay, so with the proper support, auditory hypersensitivity often improve. Yes, I do see a lot of cases. They really improve up to 70 to 80% only with diet, nutritional or biomedical supports or supplemental supports. Definitely it going to work best if you can integrate with your sensory therapy, your occupational therapy, and also some sensory auditory-based therapy. Okay. Then second thing is early identify and regulation of stress and inflammation. They are the key. Stress and inflammation, they are the key. That's why you need to do diet. You need to reduce the stress. Okay. And the last one, parent educations and consistency are critical. Parents, you have to read. Or don't depend only on your medical experts consultations, your therapists, or whoever expert. Do not depend on them 100%, because why? The consultations time is very limited. The amount of knowledge that we would want to share with you is very limited because of the durations, the time duration, the time confined during the consultations, okay, the time limitation during the consultation. So parents, you have to do a lot of reading, and reading. So once you read, please share to other parents as well. I hope it really helped you all, because I do see a lot of parents really suffer. Really, they are really suffering from this conditions. A lot of parents, they suffer. Why? Because not only the child actually suffer from the psychological pain, but it does actually affect the parents' relationship, the siblings' relationship. Okay, rejection by the school, rejection by the therapy center, even worse, rejection by the medical profession. All right. But I do not blame them. I do not blame anyone. So start from today, parents, education start from home. Okay, do a lot of reading, and sharing. So I hope it helps. So I see you again in the next episode. Bye. See you.